is Calabash community, and now we are being joined in studio by an outstanding St. Lucian medic. He is Michael Alexander, the son of Sir Darnley Alexander, the Chief Justice of Nigeria. His son, Dr. Michael Alexander, has just been recognized for performing 30,000 surgeries, mind-boggling. But there is a lot more to Dr. Alexander. He was a member of the True Tones, served on the front lines in the Biafran War in Nigeria, and today is the Chief Medical Officer and Chief of Staff of the Shouldice Hospital, considered the most efficient business in the world, the most successful hernia hospital, if we can call it that. Here is Dr. Alexander to explain.
Okay, well, to start off, the hospital super specializes in the repair of hernias of the external abdominal wall. The easiest way to explain this, a hernia is part of an organ or an organ sticking through an abnormal opening, and we just do them in the anterior abdominal wall. Commonest example is an umbilical hernia. The navel, you see lots of people, because black races all have this tendency to develop umbilical hernias. The navel sticks out, and these usually close spontaneously by age 2. So you don't even worry to operate on those. But the commonest hernia is actually in the groin, where a bulge appears in the groin, and unfortunately 1 in 16 men alive in the world has such a hernia. And for every 9 men, there's a woman with a hernia. Now, the complication is rare. Only 2 in 100 people ever get a severe complication called strangulation, but they can lose their life from this. So of course nobody wants to be in that 2%, so everybody wants their hernia repaired. Now, in 1887, this is going way back, a surgeon in Italy developed a technique for repairing these. Before that, nobody wanted their hernia fixed. There was no proper anesthesia. Nobody understood anatomy. A lot of the patients died, so nobody wanted it fixed, and the failure rate of the operation was close to 100%. This surgeon was able to bring the failure rate down to only 20%. A remarkable breakthrough, 1887. And it wasn't until 1945 when Dr. Shouldice was admitted, he was, what's the word I can use for it, press-ganged into the army. He didn't want to be in, but the war was on, and he was asked to join the army and examine soldiers for suitability for joining the army. And one of the things that gave automatic rejection was having a hernia. Because imagine being across in Europe and you get a strangulation, enemy doesn't even have to worry about you, and you take a few of your fellows along with you. So he had this fantastic idea: offer these people, who are usually young men in their late teens, a free operation and have them stay in the army facilities. And at the end of it, get them to sign up for the army. So it's a win-win. So he did this, and a number, it turns out only be about 35, he actually operated on, and they all signed up successfully. And he decided he could make a living doing this. So he decided to set up a hospital just to repair hernias. And you can say history after that, because he decided that a failure rate of 20% was much too high for somebody super specializing in just one operation. I mean, no gallbladders, no hemorrhoids, nothing at all. And after 1 year, he decided he had to do something better. So he experimented, changing one part of this technique and watching for a few months, see what happened, and then changing another, and so on. His own failure rate was 19.3% in 1945. By 1952, had brought the rate down to 0.5. And in those 6 years, word spread, and he got invitations to go and operate and teach in Russia, in Japan, all over. And the hospital just kept going from that. In 1965, he passed away, and his son took over. But by that time, we were getting a rate of only 1 in 200, 0.5, and people were coming from all over the world. So at present, we operate on patients from 104 different countries. Name it, and we've probably done a patient from there. And we have totaled now 381,000 operations, hernia operations. And there are only 10 of us on staff at the moment. So, as I said, my duty as Chief of Staff, there are lots of departments, and people just have to tell you what's going on. Very small hospital, 89 beds, but we have 160 staff. That alone is remarkable. The average number of staff members per hospital bed is anywhere up to 10, 6 to 10. We have 160 staff and 89 beds. So there's actually a little project done by Harvard University, a case study for business, showing that the Shouldice Hospital is actually the most efficient business in the world. They don't understand how we can function being funded by the Ontario government. They fund us, we are the only private hospital in Ontario that's funded by the government. Notice I didn't say fully funded. They only pay about 50% of the cost of running the hospital. So what the doctors produce is used to pay the rest. So a patient can just walk into the Shouldice hospital and get what turns out to be the best surgical repair of a hernia. Failure rate in Ontario, which has a population of over 10 million, failure rate of hospitals in Ontario is still around the 20% rate, even though the doctors deny it. But a study was just done, an independent study by the University of Toronto. We were not aware of it, comparing our Shouldice hospital with 100 of the top hospitals in Ontario, published in December 2015 in Canadian Journal of Surgery, causing a lot of consternation. A 14-year follow-up, Shouldice Hospital is 5 times better than any of these other hospitals. And an Ontario patient can walk in and have a free operation.
And you're the Chief Medical Officer?
Chief Medical Officer. You see, they wanted me to be in charge of all departments, but I still operate every day. And this is why I have a little plaque there. That's what led to your being contacted by my sister-in-law, Rennie Myers.
Yes.
She says, oh no, they have to know about this too.
Of course, by all means. We'll talk about that in just a little bit. I mentioned a couple of things. First of all, before we actually get to that, so why don't we have a few more of those hospitals? Is it a very difficult operation to run?
Yes, so unfortunately, it's, what shall we say now? It's one of the first operations a surgeon in training, now this is a qualified doctor, decides to specialize in surgery. It's one of the first operations they're taught to do, because it's accepted that the failure rate will be high. So the professor training the trainee, within a couple of months of the trainee learning to do it, trainees getting virtually the same results as a professor, if you're willing to accept that high failure rate. But ours is a very complex operation, and it's called a tissue repair, where the only foreign material going into the patient is the suture material. Now, we were able to bring the rate down, as I said, to 0.5%. They've introduced, about 20 years ago now, a mesh. This is like a net, just like mosquito netting, in fact, the same material. And this has become the gold standard of doing hernia repairs. They go in, find what's protruding through the opening, free it up and push it back in, and then put a patch on top of it. Or there's an even very sophisticated way, the laparoscopic repair, so-called keyhole surgery, where they make 3 holes, one near the navel and 2 other tiny holes, and they stick in little tubes, blow up the abdomen with carbon dioxide, then put in a camera, fiber optic camera, and roll up this screen, this mesh, feed it down a hollow tube. These are all 1 to half a centimeter in diameter. Let's have these tiny openings. And they patch it from inside. So it's very high-tech. But unfortunately, the experts who developed the technique have revealed that in their own hands, when they do this procedure, if they do the open technique, where they make a cut, lay the patch on, by 2 years, the failure rate is already 4.6%. And if they use the laparoscopic high-tech technique, the failure rate at 2 years is 10.2%. But our hospital, because we now have a 70-year follow-up, we found out that the failure rate keeps climbing steadily to 20 years. So we do not report any significant figures until we've gone past the 10-year point. And as I said, as of December of 2015, we had done 381,000 with a failure rate of just over 1%.
We'll return with Dr. Michael Alexander in just a bit. Next, he will talk about his experiences on the front lines in a bloody and deadly war in Nigeria. Dr. Alexander found himself on the front lines amid shelling and the most horrific injuries. We will hear the personal account shortly.